shape the future of nation. So on that note, let's get going right now for the next session coming our way. The topic is very significant, and I think we all will want to know more on this. Prevention as an infrastructure, the foundation of future of Bharat. Well, today, the next speaker joining us and highlighting and guiding us and navigating through this phenomenal topic is someone who is India's pioneering leaders at the forefront of health, tech, and preventive wellness transformation. For over 2 decades, she has worked in the intersection of healthcare, nutrition science, digital transformation and infrastructure, and behavior change, designing integrated ecosystem that shift healthcare from reactive treatment to proactive program. Across global and Indian enterprises, she has consistently built and scaled physical health ecosystems connecting pharmacies, clinic, doctors, diagnostics, digital platform, and personalized coaching models. Well, ladies and gentlemen, put your hands together for Ms. Amrita Asrani, Chief Marketing and Transformation Leader, Health Tech and Wellness Ecosystems.
Thank you so much. I think it's a pleasure for all of us to be here today. And since I focus on preventive healthcare and wellness, I'm really concerned that when we are talking about Bharat 2.0, all of us sitting here have been actually sedentary for the last 2 hours plus. So before I really start my topic, I would just request everyone to stand up, please. You don't need to worry. I'm not going to make you do anything. Just stand up. Just take a circle around yourself and then sit down. Yeah, just circle. That's it. Simple. Nothing else. Don't worry. No gymnastics, no Pilates, nothing at all. We're not testing any of that. Great. So I think it's been a fascinating journey, right? Till now, everyone would agree on that. And we've had some fantastic people coming here, sharing their views, and of course, the entire energy that was set in the morning with the young kids was truly, I would say, mesmerizing. What I'm going to be talking about is infrastructure. Now, we did have a lot of talks around infrastructure in the last 2+ hours. I was actually trying to note down how many times did we use the word infrastructure. And if I'm correct, I may be wrong, if I'm correct, at least 19 times the word infrastructure was used, and rightly so. Why? Because if we have to build Bharat 2.0, infrastructure is the most important thing. But what's the sad part? We all talk about infrastructure as highways, buildings, corridors, financial systems, digital pathways, education, and entrepreneurship, and innovation, and manufacturing, and R&D. But preventive healthcare is the most important infrastructure that we need to build for a future-ready Bharat 2.0. And that's what I want us to spend a little bit of time on. What I'm going to do is, before we go ahead, I just want you to spend a few seconds, not more, because this is a professional disclosure as well as a notice of disclaimer. Just a few seconds of yours if you can just read this. Okay, so I know you may have not read all of it, but you've got a gist of it. Let's proceed ahead. I'm going to bore you a little bit because I have a few slides, and I know that slides are generally boring. So don't worry, I'm not going to take a test of anything, as I said. So let's just go ahead and understand. India today is actually at an infrastructure paradox, which is invisible. I just told you that we have, on one hand, a huge amount of progress that we've made. And what is that progress on? The progress on is the hard infrastructure. Yeah. Okay. So why do I say there is an invisible infrastructure paradox? Because what you see on the extreme right hand there is the hard infrastructure that all of us focus upon and talk about. But what we need to focus on is the soft infrastructure, and that is preventive healthcare, because that is the truest asset of any nation. Now, having said this, I would want you to really understand what is the impact of this and why should we focus on this. I know there are a lot of numbers here, but you just need to focus on one key number that is in the center of the slide. So, preventive healthcare and the lack of it can actually lead to a potential projected economic loss of $6 trillion by 2030. And why? Because on one hand, we are all happy and proud that India is one of the fastest growing major economies. We've celebrated this statistic earlier in this part of the year as we overtook and became the 4th largest global major economy. We have the highest growth velocity. But along with this highest growth velocity, we also have the highest premature NCD mortality of 25%. What do we mean by that? It means that NCDs are nothing but non-communicable diseases, which is diabetes and hypertension. And when we say premature NCD mortality, we are referring to losing our young people much early on in the most productive years, which means between the ages of 30 to 70, because of all the complications of these chronic lifestyle diseases. And if that happens, then it means there is actually a human capital leak of $6 trillion. And that is something which we should all worry about. So when we look at this, what does it really mean for us? There it is. Now, what this really means is that preventive healthcare, or preventive screening for that matter, is actually not even a norm. Forget a norm, it's an exception. And when we compare ourselves, so we were talking about the top 5 global major economies. I open up this and let's talk about not just the top global major economies, but maybe some of the smaller economies, but which are very potent and very powerful when it comes to preventive screening participation. So if you look at the last column there, it talks about South Korea having the highest rates in the world of preventive screening participation to the tune of 70 to 80%. What does this mean? It means that all healthy individuals are mandated to go through, irrespective of their age, a preventive screening. It's a mandate in South Korea. And because of that, the participation of the general population is as high as 70 to 80%. Even if we look at a small economy like Thailand, it is as high as 50%. Forget talking about the bigger ones like US and China. And for India, it's less than 20%. And of course, we all know about the percentage of healthcare spending to GDP and out-of-pocket spending being 55 to 60% for India. So I'm not going to spend too much time on that. So what does all of this really mean? It means that there are global preventive healthcare models across the globe, and we need to understand what have different countries and economies done to reach this high level of preventive screening participation. So China has actually created digital preventive ecosystems. Korea, South Korea has focused on national screening as an infrastructure. US focuses on the peer-provider integration, which is incentive-driven prevention. Each country has its own merit in terms of reaching these high levels of preventive care. So what does this really mean for us as India? Now let's understand, if we looked at China as an example, what happens? So when we look at China, what is clearly observable to us is that they have created a digital and a primary care collaboration. Now, when we see this model, it clearly tells us that this particular program wherein they have combined and created a transformation from reactive to proactive digital first ecosystems. So, Pinga Good Doctor has 400 million plus registered users, and there they actually have an AI triage with the help of preventive screening, diagnostics, even the government is backing community screening. So, when all of this happens, along with primary care support, so digital infrastructure and primary care support, that definitely leads to prevention being scalable. So, that is what we can learn from China. Now, let us look at the South Korea model. This is super interesting. As I said, in South Korea, it is mandated that the minute you are 20 years old, every 2 years, you have to undergo preventive health checkups. And not just once, it continues. So, you have to do that every 2 years. It's mandatory. So, preventive health screening is a mandatory civic infrastructure. And then as you cross the 40s and the 50s, there are additional health screening checks that get added on based on the lifestyle risk that you may have. This has actually led to South Korea having not just the highest preventive health screening, which is 75%, that is the participation of the general public, but also the highest life expectancy in the world. So, what you see here is an 83-year-old lifespan, which is actually becoming an 83-year-old health span. So, it's not just about living longer, but living a higher quality of life. And that's all possible because of this mandatory civic infrastructure of preventive health checkups. That's what we can learn from Korea. Now, let's talk about US. I think many of us know about the integrated payer and provider model. And what that really means is they have integrated clinics, diagnostics, screening, doctors, insurance, hospitals, all of them coming together. The interesting learning is that when payments and these models of payment reward prevention, what happens is healthcare systems actually invest in keeping people healthy rather than making them fall sick. And that is the most important learning from US. So, the Kaiser Permanente model actually enables to get a preventing screening up by nearly about 70 to 80%, and hospitalization rates are lower by 15 to 20%. And then of course, the icing on the cake is a chronic disease, a lifestyle disease like hypertension remains controlled. And as per global evidence, what we know is every $1 that you invest in preventive health care leads to a 4x dividend, a minimum 4x dividend of $4 to $7 of treatment costs coming down. So, that's the key learning that we have from the US. What does this mean for Bharat? Bharat has a unique advantage. Why do I say so? Because we are uniquely positioned to actually transition from the hospital only model. We can leapfrog from this. Why? Because we have 1.2 million frontline support system. You know who am I talking about? India has the highest number of pharmacies as a network across the world. So, we have 70,000 hospitals, which is also very high and again highest across the world, but we have 1.2 million pharmacies. What that really means is 18 pharmacies for every one hospital. So, this makes Bharat have the highest frontline to critical care ratio, and this is an infrastructure already existing with us. So, what does that mean? It's good news, because we can convert these pharmacies into preventive and diagnostic patient care centers, which is PDPCs. And this is what a pharmacy would do. Today, our 1.2 million pharmacies, what do? We actually treat them like a vending machine. You know, people fall sick, you dispense a medicine. That's not actually good utilization of these 1.2 million pharmacies. If we convert them into preventive healthcare hubs, what will happen is there will be screening, there will be diagnostics, there will be telemedicine, and there will be behavioral coaching. When we offer this behavioral coaching, it will take time, but it will enable Bharat to be future ready by transitioning from reactive to proactive consumption of healthcare, which is good for us. And obviously, again, as per global estimates, just to remind you about the 4x dividend, which is every $1 invested in prevention actually leads to treatment costs coming down by $4 to $7. Now, you will say, great, Amrita, this sounds super interesting, but how difficult to execute? Why are we talking these big things? That's the most interesting part of this. We don't have to build this. What do I mean? I'm saying it again. We don't have to build this infrastructure. This infrastructure exists with us. We have 1.2 million pharmacies, and we have the digital layer, the digital national health stack. We have the Ayushman Bharat digital mission. We have the Ayushman Bharat health accounts. All of this exists, the unified health IDs. When we utilize this along with our pharmacies, which are physical points of care across neighborhoods across the country, what happens is that we will be working towards a future-ready Bharat by protecting the human capital and enhancing the productivity of our young people. Now, it's very interesting to say that, you know, Bharat 2.0, but what does it mean? Are we going to just play catch up with the world? No, we don't need to. We are actually going to leapfrog the world, because for a 2047 Viksit Bharat, our mission should be very simple, and that is not to build, but to activate the world's largest preventive healthcare infrastructure. So I would invite each one of you present here, you've given your time to be here. I invite you to come with me and let's get on to this journey right from today. It all begins today. So come, let's partner together and let's build the world's largest preventive healthcare infrastructure, not by actually building it, as I said, but by investing our time to activate it. And I would just rest my proposition here. Thank you so much. Open for your questions. Any questions that you would like me to address? Yes.
The presentation was really good, and as a doctor,
Thank you.
gave me a lot of insight. So the numbers which you gave, the active pharmacies which are available, but do you not think that, you know, there are lots of challenges when we use this pharmacy as using tool for preventive, you know, preventive checkups, or, you know, because whenever we want to do so, we will also have lots of, you know, unnecessary tests or unnecessary things that will be going around, which will again be economical loss. First thing is that. Second thing is there will also be, you know, shortage of availability of doctors, because a lot of time whenever we write prescriptions, it should be, you know, signed by a physician. So, and we know that, you know, the number of doctors per, you know, to the set of people is really less. So do you know, you don't think that we will have to overcome these challenges? And to overcome these challenges, we will have to, you know, figure out more important questions rather than jumping directly into this. So what are, like, you know, what I want to know is, like, you know, you gave a point here. So I'm sure you must have taken yourself through a lot of roadblocks and some challenges and questions. So what are those things? Have you overcome that? This is what I think as a doctor, you know, because...
Sure, yeah. Thank you, Dr. Meenal. I think a very fair question. And you're so very correct, because obviously you are a doctor and you see all of this happening on a day-to-day basis. So the whole healthcare industry, as we all know, is super regulated. And one needs a superlative understanding of healthcare to be able to run a model like this. So you are bang on when you say that. But what we are proposing here is not just a model in isolation, because when we are talking about such a big transformation, you know, from reactive health to proactive health, and I'm sure you will agree, being a doctor yourself, it needs an ecosystem. The ultimate goal is to get more people to become aware about their health, and their first point of contact is the neighborhood pharmacy. And also in terms of accessibility, the numbers outbeat sheer the number of hospitals. So what we are saying is that the pharmacies become the first point of contact. But ultimately, like the China model or the Korea model or the US model, we need to integrate, you know, all the different stakeholders. But what we are suggesting is that as a citizen, I first come to my pharmacy. It's not the be all end all. And ultimately, from the pharmacy, with basics being done first, which are today not in place, like basic screening, basic awareness, basic, you know, education, then we connect to the entire network. But in that bargain, when we do this, what happens is at least we get a digital health ID. At least we get the first point of care, somebody to guide. So it's the role of the guide that the pharmacist would play rather than prescribe. And of course, then we redirect all of that, you know, as you were talking about the small clinics, the larger clinics, the medium-sized clinics, and then of course the hospitals. But getting the whole network together and supporting this being the first point of care or the point of contact would be the goal. But it has to be done collectively as an ecosystem. Yeah.
Hi, very nice facts and figures. It's remind me a few years back. I'm coming from basically tier 2, 3 city, that is Indore. So a few years back, there's a one ATM concept, the screening ATM, some of the YOLO health or something like that. So this basically concepts come very aggressively and just shut it down the each and every operations out there. So did you heard about that, and do you have any view what is going on with them?
Sure. I haven't specifically gone through this particular case, but a lot of similar cases, because there are many entrepreneurs who are trying to bridge this gap, like you said, you know. So this is something which people are trying to do. But my humble submission in this context would be, again, going back to, you know, the same point. This is not a problem that can be solved by 1, 2, 3, 10, 100,000 or lakh. It has to be 1.4 billion people being represented by a set of people so that the ecosystem is created. Because what happens is it becomes a fad, and today, you know, I always say this, like I've been a proponent of health and wellness from the last 20 plus years when people didn't even know how to pronounce the word wellness. So sorry, I'll digress to saying this because it's important. When I told my parents, when I was just entering, you know, my college, and then I was doing my graduation, post-graduation, and entering the world of work, I said I want to work in wellness. You imagine 20 years back, people thought, kya nurse banna hai aapko? Like, what did you just say? I can't even fathom. Today, like all our Gen Zs, because we are surrounded by health and wellness startups, it's a common term. But 20 years back, people didn't know this. Now, why do I say this? Because wellness is a fad. I'm not talking about wellness. I'm not talking about gizmo. I'm not talking about some new technology that comes or a wearable that comes. Let's just grab onto it, and after 1 year, it kind of goes down. So it's like those, you know, cycles of up and down. So I firmly believe that prevention is not a wellness program. Prevention is an economic infrastructure. And the more we try to, you know, move away from that and make it sound like a fad or something new that has come in the market or this new thing that needs to be done, it kind of goes through those cycles of which, sorry to say, but which person on social media is promoting it or not promoting it. But that's not what we should do. I think the whole system needs to work together. And because this is a very scientific industry which is based on trust, we are dealing with lives of people. So clinical trust and credibility becomes super important. Today it's extremely difficult to even read the label of a food product, forget anything else. You know, when we forget buying supplements, that's a totally, I think you need to do a PhD on that. which most people don't understand. That's why in India we, the lowest consumption of supplements in the world, despite the supplement industry booming like anything, but per capita consumption is not growing. I've tracked it for the last 20 years because of precisely this thing. Ek cheez aati hai, I'll say it in Hindi, it goes up and then it goes down, but nothing stays constant. So I would really be wary of doing something which lacks clinical trust and credibility, and of course the backing of the whole ecosystem with the doctors, with the pharmacists, with the diagnostics and the preventative screening coming in, all working together to give a holistic 360 answer.
Thank you.
Yes, yeah.
Hi, I actually like the way South Korea is doing the screening of citizens, and I see an immense potential of knowing the customers, like the bank knows by the KYC.
Yes.
The government is trying to do the same thing with their citizens. And there is a huge data angle coming through it, because I see my population every 2 years, their nutrition, their height, weight, their chemical composition inside their blood.
Yeah.
And I see a huge insights coming from that particular activity. So that is affecting my national nutrition policy.
Yeah.
I can sell that data to insurance to
Yeah.
make their policies better. And there are enormous use cases out of it.
Right.
So even just not looking at the preventive side of it, and even at the data side of it, I see a huge potential out of it. But the only bottleneck which I feel, I think you will agree to that, is only the government push can get you the regular screenings, because that's the thing which is required. So what's your perspective towards the data side towards you?
Yeah, thank you. Very good question. So I'll just go back in time, maybe again 2 decades back, when, at least I would say for myself, I didn't know what is Aadhaar. I myself didn't know what it is unless it was mandated by the government. Now everybody knows Aadhaar. So each thing has had its own, phase of evolution. And things have been mandated. Today if you go somewhere, I think if I just ask all of us to remove a mobile phone, even if we don't have a hard copy, we will have a soft copy somewhere on WhatsApp, somewhere on your email, somewhere or the other. So it's like Aadhaar to hona hi hai, like we have to have a Aadhaar. And then obviously came UPI, and now we talk about Aadhaar and PAN getting linked. Now that is also going up in numbers. So similarly, just to give a little bit of an idea, because obviously I was studying this subject in great amount of detail, if you look at the Aadhaar IDs that we have, which is the Ayushman Bharat health accounts, or for that matter the entire Ayushman Bharat digital mission, I was surprised personally to read these numbers. 80 crore is the number of unique health IDs that have been created till date, and they are interoperable and searchable. That was fascinating to me. So it's not going to be too late, because it is happening in a similar fashion. Of course, it's going to be time taking, painstaking, efforts taking, all of that, but it is happening somewhere behind the scenes. 8.5 lakh pharmacies have actually been backtracked and linked to the system. But yes, it's a long way to go. It's exactly, I would say 10x more than what Aadhaar was, because that was the first step. But the digital public infrastructure that has been created by the whole Ayushman Bharat digital mission, and as well as the Aadhaar IDs, and then the whole unified health interface and ID that is getting created, the way if it gets implemented like this and then mandated over a period of time, it will happen. It will happen. It will be time-taking, it will be painstaking, it will be sometimes for some people irritating, but it is for the better. Because only when we have the complete data, as you said, that's when things take off. And today, thanks to all these wearables that we have, we are getting a lot of data. We are getting so much of data, but we need much more. And today people don't know what to do with their data, and I think, as he was saying, there are a lot of new age things that come up, but again it goes down. So there is no consistency and there is no reliability. And I think that's where the role of both public and private players coming together, because this health challenge cannot be resolved by either one in isolation. So I think it has to be done with a lot of consistent effort and mandated. And then we could probably go into seeing, I would say, at least a quarter of what Korea has done. Yeah, thank you. Yes.
Hi, this is Anuja. I'm from environment background. So my question to you, the change in environment, how it is impacting the things, one thing, and how AI is going to help you towards this mission. So that is 2 questions from my side.
Sure, thank you. I may not be as qualified, medically to kind of comment on this, but since you've asked me the question and I'm standing here, I'll give my best shot in answering that. So of course there are a lot of factors today. So if you really get into nutrition science and health science, and when both of them come together, I think it's the microbiome, it's mental health, it's environmental, it's water, so it's everything basically. So, and this continues to be, it used to be 1,000 decades back, it is today in a different way, and it grows exponentially day by day, decade by decade. So I think it's insufficient for me to really comment on the role of how the external environment is, because there are many more factors, and this is why, as I said, I repeat that fact because that is the one fact that fascinates me from the last 2 decades, and I've tracked it personally for 2 decades. The per capita consumption of health supplements and nutraceuticals in India remains to be one of the lowest in the world. You would be shocked to know that if we did a study amongst the higher socioeconomic strata, I don't want to do any bias, but that's based on some data, which is the upper socioeconomic strata, and I'm only restricting it to the extreme upper end. Can you guess what is India's per capita consumption spends on health supplements, which we talk about and see all over media and say it's booming, it's booming, it's booming. 600 rupees in a year, 600 rupees, and I'm talking about only the socio-economic strata classification of A, A1, A2. I've not yet gone to B. And this remains, this has not grown exponentially, but the wellness industry that we talk about all over grows exponentially because we are a 1.4 billion population, not because at a per capita level we are increasing the number of preventative health supplements that we're consuming. So, environment has a great role to play, but there are many, many things. It's not going to be, if I answer your question, I can answer it and say, oh, this is the cause or this is what it means, but it would be not even half baked. It's an incomplete answer because it's a 360 impact on preventative health, because I don't have a disease, it's preventative. So everything is interacting with me right now. And your second point, which was all about AI, I think AI is, of course, it's everywhere, but when it comes to preventative health, and based on some of the examples that I have studied deeply, especially the China case study. So first, it's a digital first model to kind of get people on and know who they are, just like an Aadhaar ID, so a digital ID. So I think that's number one. The biggest breakthrough is when we use AI and AI triage to actually do preventative screening, which is practically low or no cost. Because the minute I tell you, hey listen, you don't have any health problem right now, but you have to go and spend X amount of rupees in doing 1, 2, 3, 4, 5, 6, 7, 8, 100 tests, you'll be like, she's gone mad. I don't have anything, you're making me a patient. And that understanding, but if I tell you it's free, you'll be like, ha kar do, it's okay, doesn't matter. So AI can actually help us to do a lot of screening. It's not a diagnosis detection of a disease, but it's risk assessment. And that could be a game changer, especially for India, to help people cross that chasm from a reactive to a proactive mindset.